Good morning. On the occasion of World Autism Day, we, team from HM Reliance Foundation Hospital and Research Center, have gathered together to discuss on the topic of autism. I myself am Dr. Priyanka Puri. I'm a consultant child psychologist with Sir HM Reliance Foundation Hospital and Research Center.
Good morning, everyone. I'm Dr. Iravati Purandare. I'm a neurodevelopmental pediatrician and I'm working in this field since more than 12 years. At Sir H.M. Reliance, I'm a consultant looking at the developmental disabilities.
Good morning. I'm Dr. Sayli Bidkar. I'm a pediatric neurologist working at Sir H.M. Reliance Hospital, Mumbai.
Okay, so we'll be discussing on the topic of autism, and I would like to ask Dr. Iravati, what is autism and how it is differentiated from autism spectrum disorder?
So, autism is basically what we say is a neurodevelopmental disorder. But that means that it is arising from the brain. There is some dysfunction in the brain, which leads to, which affects the child's development. Now, as we understand that brain does everything in terms of how we learn different things, how we learn to socialize, how we learn to interact with people, etc. So the problem starts from the brain and it affects the child very early on in life, and it affects the different aspects of socializing, how the child learns to communicate with others, how he observes the environment around, and how it reacts in terms of different behaviors. So that is why it affects the development, and then for ahead it will affect the learning of a child and probably the vocation, etc.
Right, as rightly said, ma'am, for parents, what are the common symptoms that they should be looking out for, the in their children, and what are the symptoms that they should be concerned and worried about?
So the basic core features, or what we say for autism to be diagnosed, is basically they have deficits in social interaction, that how you interact with other people. Then there is a deficit in communication, like how you convey your feelings, how you understand what the other person is telling you, how are you going to say what you're feeling, how you express your anger, your pain, your happiness. You want to share your feelings with other people. So that communication is not there and the language is impaired. And then there are some typical behaviors which are seen more of restricted, repetitive patterns. Now, how do you really see whether these are coming on? How do you get a clue whether, what do you look out for early on in a child who is nearly 1 year of age? So the red flags, what we call them at early age, is having a good eye contact. So you have a 6 month old child who will give you, a good eye contact. He'll like looking at your face, observing new people. He'll give you beautiful smiles. He'll be playful. When you play peekaboo, he'll be interested in watching you, etc. He'll try to show you things. By 1 year of age, the child will point out to different things. You have taught a child, show me your nose, show me your eyes. So the child will start showing you that, where is the fan, etc. He will try to engage you, and after you have taught him that, a child will try to show you, hey, mama, look, I can see a crow. So this is what is called as sharing of interest. So these are certain features which you will look out for. You call a child, the child will look at you. He will say mama, he'll say papa, he will start recognizing family members. He'll start understanding a lot of basic language before he starts to speak. So by 1 year of age, most of your simple instructions, your commands, the child will be able to follow. So these are a few red flags that you need to look out for.
Right, as rightly said, now what would be the symptoms, or what should a parent look in a child that they should get the child for treatment or intervention or therapy to a professional? What do you think, according to you, like what are things that parents should be looking out for, that this is the time that now we need to seek professional help?
So by 1 year of age or 15 months of age, we expect a child to, point out at things. You respond to your, whatever instructions you're saying, understand what you're saying and respond appropriately. He should be responding to his name much earlier. By 15 months to 1.5 years of age, we expect a child to use at least 10 to 15 words with meaning. Meaningfully, it might not be complete words, but he might just say pa or ba or bo.
Right.
So, whatever words or syllables that the child is using should be meaningful.
Correct.
So, there should be a meaningful communication which is happening between the child even at 1.5 years of age. So, those are certain things I feel the parent should look out for a good sustained eye contact and how the child is communicating with them, or the child is totally in its own world doing what he or she wants to do and just coming to the parents for its needs.
Correct, rightly said. So these are very important areas and these are very important things that a parent should be aware of and should consider them as red flags and look out for help. Okay, Dr. Sayali, what according to you are the causes for such kind of a disorder? Like what is the actual cause behind autism?
See, the thing is, autism is a neurodevelopmental disorder as told by Dr. Iravati. It's a diverse condition. So there is no single cause which we can point out is responsible for his condition. So a lot of research has happened, a lot of hypothesis has been put forward, and came to a conclusion that there are some genetic and environmental factors that are like a non-genetic factors, and there is interplay between this genetic and non-genetic factors which is responsible for this condition. Yeah, definitely some of the high risk conditions which we can say is one of is high parental age. High parental age, extreme prematurity or NICU stay, birth asphyxias are definitely associated with autism. Some of the kids with autism are looking different from the normal. So they will have some facial dysmorphism, and in amongst them, like fragile legs or cerebral creatine deficiency kids will have some different facial features. So in them, around 10% of the cases can have some genetic predisposition. Also, there is a familial risk of autism. If one kid is affected with autism, the chances of second kid being affected with autism increases to 10%. So again, some familial, genetic, and most importantly, unknown or non-genetic factors come together to cause autism, and there is no single cause which has been explained in detail that this is only the reason for autism, and much more research is required for the same.
Correct.
So more or less, it's more like an interplay of all the
Correct.
genetic, environmental, familial factors.
Sure, correct.
Right. So, according to you, what are the comorbidities associated with such a problem?
See, when we see autism, we always call it as an autism spectrum disorder. So the intensity of signs symptoms may vary. And along with the features of autism like poor eye contact, poor socialization, stereotypic repetitive behaviors, some of the kids with autism will have some comorbidities. Comorbidities commonly associated with autism is one of most common thing is epilepsy. So epilepsy is nothing but recurrent seizures, or if any child is having tendency to get recurrent seizures or fits, it's called epilepsy. So when we see a general population, around 2 to 5% population can have a tendency of epilepsy, but in autism that risk increases to 20 to 25%. So definitely epilepsy is considered to be one of the major comorbidities associated with autism. Second most of important thing with autism is feeding difficulties. As ma'am has mentioned that kids with autism have some sensory issues. They will have some food choices, like only that choice food they can tolerate. So because of that, parents have find lot of difficulties in feeding them. So because of them, that condition, they are also more prone for constipation, irritable bowel syndrome, painful bowel movements, and on counterpart, these kids are also have high risk of developing obesity. If we see compared to general population, the risk of obesity is around 10%. But if we see in autism, that risk increases to 20 to 25%, again because of this food aversions or typical food which they want to take. Apart from epilepsy and feeding difficulties, other comorbidities with autism is the sleep issues. So kids with autism have problem in initiating the sleep. Also, they have this interrupted sleep cycle. So they will have frequent night arousals. they feel very difficult to fall to the sleep. So these sleep issues are also one of the major comorbidities, and for parents to look to these comorbidities, it becomes difficult for them. Other comorbidities with autism is a behavioral issues. So many kids with autism will have some form of hyperactivity. They might have this along with hyperactivity in attention or impulsivity, so which we will fall in the category of ADHD. Some kids with autism will have disruptive behaviors like self-hitting, biting, or even biting or harming to the other people. So that is again most important comorbidities that needs to be addressed when we are dealing with a kid with autism. So when we are looking at a child with autism, apart from his core features, we always should ask for the comorbidities associated, and we should always look in the treatment of that comorbidities to get the benefits.
Right, very rightly said. Now, when do you feel the need for detailed investigation with these children?
Yeah. So, as we have said, it's a neurodevelopmental condition, main disorder of expressive language or receptive language both. Usually, kids with autism doesn't need a detailed evaluation if he is fitting in the core criteria, if he is not having associated features. So, usually, only the developmental assessment developmental assessment can be only required thing. But how to go ahead? When you need a special test like EEG, MRI, when to go for that? So as I mentioned, some children with autism are a high risk of epilepsy. So if there is any history of epilepsy, if child is developing well, suddenly regressed. So if there is something new which parents have observed, in them we need to consider EEG. MRI is again required if there is refractory epilepsy in them. If we are seeing some facial dysmorphism associated, definitely we can consider MRI. Genetics, if there is strong family history, or if you are looking some abnormal facial features, only in that cases we will ask for a genetic evaluation. So routinely for kids with autism, these tests are not required. This will depend upon case to case basis. Only if there are indications, we will go for this test, which includes EEG, MRI, and maybe a genetic evaluation.
Right. So, from what Dr. Sayli has told us, we understand that autism is a condition which has many accompanying things coming along with it. So, there are a few medical conditions, there are a few genetic conditions, there are a few epilepsies which have autism in combination with them, or those children show features of autism. There are many children who have low IQ or a low intelligence, they also show a few features of autism. So, autism is a trait or a behavioral trait, or the way socializing and communication is impacted, and it might have other things which are with the autism. So, the investigations will be targeted to see whether we have any other underlying cause, and whether the comorbidities are because of certain things and how we can help them. So, that will direct us towards therapies of those comorbidities. Okay, so now we go ahead to the diagnosis. Like, how do you diagnose now? And when do you diagnose? And
Yeah,
Dr.
so
Priyanka.
as a psychologist, clinical psychologist, we use initial strategies for diagnosis would be detailed observation of the child's abilities and capabilities, also observation of the family structure and its functioning. Along with that, we include screening. There is no medical equipment used for screening or diagnostic testing. In fact, there is a questionnaire, a paper pencil structured questionnaire, which to be filled by the parent to know the family history, the child's history, and the other environmental factors pertaining to the child. Also, if the age of the child is above 7 years, so there is a self-directed questionnaire for the child itself, and the school questionnaire where teacher and other educational modalities are involved. So therefore, we take consideration of the whole environment of the child before we diagnose the child. Also, once the diagnosis is established, in terms of screening or the testing or the diagnostic tool, we look at the intensity of the issue. So there would be a mild, moderate to a severe intensity of conditions, and accordingly, treatments are provided depending on the child's intensity as well as the environment and the structure in which the child has been upbrought.
So, with the diagnosis, we can see that autism being a spectrum can range from very mild to few features to a very severe condition. So, making a diagnosis and as you know that the how the child presents in different situations can be different. So, if you observe a child over half an hour period, the same child you would find him to behave differently in the home environment. So, making a diagnosis and is a little difficult thing. So you have to have a good observation, good interview with the parents before you diagnose. And because it is a spectrum, it shows the symptoms change over a period of time as the child moves ahead. Depends on the interventions, etc. Also.
Very nicely mentioned by Dr. Priyanka that diagnosing is very easy with a paper pen questionnaire. There is nothing special required by parents, by the doctor for diagnosing autism. So, as mentioned by Dr. Priyanka about the diagnostic strategies, we'll just move ahead. And would you like to talk about different treatment options, like different therapies which are available for autism?
Right. So, looking at the intervention, we come down to treatment. Now, treatment involves therapies. I'll first explain the term what does therapy mean. Therapy means management or learning strategies, activities which are used for a disability mentally or physically where there is no drug or medical equipment involved. Okay, so treatment or therapies involve direct contact with the child. The goal of the treatment is to bring functional independence in the child, to bring adaptive and play skills, social skills, to involve remediation, to improve academic performance, to bring life skills in the child so that the child is able to fully functional. Now, the treatment or the therapies are not restricted just to the children. They involve family as the biggest care supporter with them. Together, the family, the academic, the teacher, and the child together form the treatment or the management for the autistic children. Now, there are different kinds of treatments or therapies available depending on the need of the child. So, there is sensory integration therapy available where we look at and enhance the five senses of the children in different forms. So, there can be a movement therapy, there can be a play therapy, there can be an art therapy, there can be music therapy, and also latest Autism India has developed a fun therapy where games and different modalities now available with us help the children to form and overcome their sensory issues. Also, very popular and very effective is ABA, which means Adaptive Behavioral Analysis. It is based on a reward and intensive system where the particular behaviors which are beneficial are established by the parent for the child with the system of reward. And this involves developing language skills, communication skills, social skills, life skills, and also when we are doing therapies, our basic goal is not to develop particular issues like speech or small modalities. The issue is to develop management for the child, so develop communication skills where the child even can use receptive language. They can use non-verbal communication to express themselves, so they look at the larger benefit for the child. And also in terms of therapies, there are a lot of therapies available in the market, but it is very important for us to look at the strengths of the child. What is the need for the child? How the family and the caregiver can support those needs and then go for the particular kind of therapy.
Very nicely said, Dr. Priyanka, that functional independence of the child is the goal, is a primary goal from a part of the psychologist, and it will be very rewarding to the family. But while achieving this functional independence and this dealing with the child with autism and comorbidities associated with autism, sometimes it becomes very difficult for the family. So, according to you, what are the coping strategies for the family and the primary caregivers.
It is very important to look for the coping strategies or to provide strength to the family, because it is not an easy parenting here. We are dealing with a child with so much issues, and it is very taxing for the parent as well. So it is very important to keep a positive parenting approach. Look on the brighter sides, look on the strengths of the child and build on them. For example, if child has sensitivity to music or is very good at music, then build those skills and help those skills to build further different skills as in academics or in vocational skills. So we always have to look at a positive parenting. Along with that, it is very important that we use a positive disciplining style. Please do not engage in punishments, in hitting your child, in scolding your child for the behavior which are in not control of them. This is not something that they are doing to tease you or to disturb your mental peace or to disturb the social environment. This is something which is neurologically established, as explained by the doctors here. So this is a condition, this is a problem. So we need to tackle it with patience, with love, and with care. Having said that, we also need to have proper routine, proper timetable for the children. We need to make sure that we make the child independent and there is a self-efficacy involved. Along with this, for the caregiver, it is very important that you take care of yourself as parents. It's very important that first of all you seek support. Look out for communities where you have similar parents with similar children, similar background and similar problems of the children. You talk to them, share your views, share your grievances, and ensure the support from them. Also, having said that, be aware, ask questions, be aware and seek support. You should know what are the advantages, what are the disadvantages, where you can seek help and how you can seek help. Another thing, spend time for your own self. Do not forget your own self as a parent, because the more healthy mentally, physically you are, the better you can take care of your own child. So it's very important that we look it at a positive side. I know it is very difficult, but if we try to look out for one or two strengths, we can help to manage this issue and this problem better.
Thank you, Dr. Priyanka. That was very well said. So, what we have to take away from this is that the role of the primary caregiver or in the family is extremely critical. Many times, most of the times, we see that the parents really have not understood what to do for the child, what to expect, and what is the way ahead. So they are just running from one therapist to another. So I feel the parents need to be empowered. They need to, put their focus to really understand what it means to that child is wanting to say, or how do I work with my child? What are the strengths, as she has rightly said, not just looking at the weaknesses. And then learn from the therapist. All are there to help you, and then you are the person who is going to really guide everything. So apart from that, we say that the behavior intervention intensive therapies are the most beneficial, but there is a role for medication. And I would like to ask Dr. Sayli, when would she consider medicating children, or is there a role for any complementary medication in these children?
So the thing is, if the child with autism have a comorbidities, so if he has a comorbidity in the form of epilepsy, definitely epilepsy needs to be treated, because that will have a long-term impact on the IQ, long-term impact on the further development. So definitely that needs treatment. If the child with autism has significant behavioral issues in the form of disruptive behavior, injuring self or injuring somebody else, that part needs to be taken care of. But apart from the comorbidities, if you ask me about the role of medication per se in autism, yes, there is a term called as a complementary alternative medicines. What does complementary means? Complementary is additional to your conventional therapy. What is alternative means? It is alternate to your conventional therapies. So there are a lot of researches going on, a lot of hypotheses being put forward, like role of multivitamins, role of suppose carnosine, or role of some
Omega
medication
fatty
like
acids.
omega fatty acids. some multivitamins, mega neurons, mega vitamins. So these roles are still under trial. Whenever we are prescribing this medication, parents should definitely see the safety, the efficacy, and side effect profile, and then we need to choose whether we can give that or we can't give that. But definitely, there are some therapies which are absolutely contraindicated or which are absolutely no. From the part as a team of doctors, we will try to enforce. That is, stem cell therapy is absolutely contraindicated for autism. Shock therapy is not at all recommended for autism. So these are the things which parents should not do. Role of music therapy is definitely considered to be a positive feedback. There is something called as a neurofeedback therapy where we use EEGs for modulating the behavior of the child. That is still under research. That needs further investigation before concluding it as an efficacious. So if sometimes parents comes with the question that can they give some allopathy or homeopathy medications? So to them, I just want to tell whenever they are using this medication, please reveal the same to your treating doctor so the treating doctor can see if there is any interaction between the medications which he is taking and we can keep a close watch on the side effect profiles of the same. So as of now, that is the only role of complementary alternative medicines in autism. If I can ask Dr. Priyanka, any special schooling systems which are available in India for the kids with autism, and what are the educational guidelines for the kids, especially in India?
Right. So, looking at the educational guidelines, I want every parent should know that under the Act of Government of India, under Disability Act, there is no child, especially with autism, can be denied admission to a school which is funded by the state. Along with that, there is complimentary, free, and compulsory education till 14 years of age. So we should be aware of as a parent that no school which is funded by the state can deny admission to your child on basis of any disability, especially autism. Now, looking at that, there are other private schools also. Now they have opened up their gates for children with certain disabilities like ADHD and autism and learning disabilities, and it is called integrated or inclusive education, where they bring these children with disability as well as the other children together in an educational setup. Now, when they say integrated education, they mean that there will be a faculty which will make an individualized plan for education for these children where their strengths, again as I said, if their kinesthetic sense is strong or their vision sense is strong or their hearing sense is strong, any sensory modality which is strong, that will be the base of teaching, that will be the mode of teaching for those children. So if the child cannot speak, then the written or the expression would be the form of their communication or assessment. So there are schools in every city. There are schools in developed cities where these facilities are available, and I'm talking about the private schools as well as the state schools. Also, along with that, they have special educators which look at the remediation, which is the educational foundation for these children. They use different modalities to teach these children rather than the teacher and the student method. Also, along with that, some private schools have also come with the concept of a shadow teacher. The teacher, there is one teacher in the classroom which is explaining the conceptual functioning, but along with that, there is a shadow teacher which helps the child to understand those conceptual functioning in the strengths of the child. So they are child specific driven training that is provided. Also, looking at the special schools, they help children with developing social skills, sensory skills where they give different sensory texture exposure to children. Then they also look at fine motor skills building, gross motor skills building, and self-efficacy and life skills. So we should, as a parent, opt for, depending on the age and the grade level and our background, we should opt for these special training and special schools for children and enter into integrated schools for our child for a better and a healthy upbringing.
Before going next, one important question I would like to ask both of you What are your opinion about screen time? Because nowadays, till 1 year of age, if a kid or infant is using mobile, parents are very happy and with proud they will say that my child can operate mobile. So what is the impact of screen time in autism? What are your thoughts behind it?
Okay, so recently there is a research after COVID, WHO has come up with digital autism. Okay, there is being a research still going on very young children around age from 0 to 3 years, where when they are exposed to screen a lot more than which is healthy for them and to content which is not healthy to them, they do develop pseudo symptoms of autism. So we should, as parents, be very careful of what we are exposing a child to. And as WHO norm says that from 0 to 2 years, there should be no screen at all. Your child is not built up. The brain doesn't build up if you expose them to such screen. And from 2 to 3 years, then half an hour with adult supervision and so on goes for the children. So, as a psychologist, I definitely say that please make the minimal use of screen and, if required, in emergency situations only.
Yeah. So, like we said, in COVID, many parents had this concern. The parents were working, and or if they are with the grandparents, then many a times it happens that the child is given the screen and left to do, because then the child sits in one place and doesn't disturb. But then, like she rightly said, 0 to 2 years is the time of your formative years where you learn the basis of how you form your relations, how you learn language, how to observe people. So if you're not observing that, if you're not interacting with people, if you're not, looking around, playing, doing things which are needed for your development, then you're just with the screen. The screen is not having a dialogue with you. Okay, so it will teach you words, but it will not teach you how to communicate. So we don't want that at all. So
Very nicely
yes,
said.
yes.
It will teach you the words, but it will not
So
teach
we
you the
see so many
communication.
kids who are repeating words, but they are not communicating.
And also, they have developed an accent because
Yes.
the cartoons or the exposure that they are British or American based, and they have a particular accent of talking. So, a lot of children who come in this tender age, they have the accent, which disrupts the pronunciation, and again, then the speech becomes non-understandable. Okay, having said that, Dr. Iravati, I would like you to share a few pointers or the takeaways for our parents or the listeners today, and keep that in their mind.
So, as we see that even though autism has been, described with century back, and it has gone through a lot of revisions in its diagnostic criteria, revision in how you call it, different names, etc. Still, we are not completely understanding why it is happening, how to treat a child, what is the best modality, what are the different other treatments that will benefit. So we are still grappling, is what I feel. But one thing I feel should be, it is very, very important that you do find and get these children as early as possible. You try to, there should be a lot of more awareness, not neglect any child who is not communicating, who is having speech delay. Get that child evaluated, get that child screened, start intervention, start therapy. The child eventually will outgrow it if it doesn't need. But don't ignore, don't delay, is what is more important. And medications will help, but it is not going to cure. The intervention is going to be the most beneficial. Behavior therapies, occupational therapy, speech therapy are the most important modalities of treatment. So please stress on that. Involvement of the parent and family is very, very critical, because those are the people who are there with the child 24 by 7. They know their child the best. They know what will bring out the best in their child. They know how to manage the tantrums, how to manage the behavior. So educating a parent is utmost important. And then finally, you don't run for a cure. You understand that it is a type of a neurodiversity. It is a type in which the person is made. I would like to put it at that. And how would you help that person to become more functional in his day-to-day skills? How do you help that person to learn? How do you help that person to find a vocation with all his problems. So how do you overcome them? And all these things will help a child or a person achieve optimal life. So finally, you have to look at his quality of life, and instead of running after how many words he's saying, so even non-verbal communication, communication of any type, gestures, eye contact, pointing, non-verbal words, etc., is accepted as far as the point is conveyed. So I think it needs a perspective from in terms of what the parents understand and what we want these children to achieve.
Yeah. Yeah. So having said that, thank you so much for joining us and listening to us.
Thank you.
Thank you.
If there are any questions, you can type in the chat box and we would be happy to help you for the same. Thanks a lot.
Thank you.